Well, Scott, thank you very much for taking the time to join me today.
Happy to be here.
So we are talking about spasticity. And so I'll start by asking, can you summarize for us the scope of the problem when it comes to spasticity in people with MS?
Absolutely. So spasticity is likely one of the most common symptoms that our patients, suffer with, and one of the most common signs that we see at the bedside. And if you read what's out in the literature, approximately 80% of our patients will have spasticity at some point during their journey with MS. And staggering, about a third of those patients will be deemed to have moderate to severe spasticity. Now, the severity of spasticity seems to correlate quite nicely with disability and also quality of life metrics in people with MS. It is extremely disruptive to people's life, even beyond the physical. But some of the physical manifestations that we will hear and see is spasticity can impact gait and balance. It can cause a tremendous amount of pain for our patients. It can actually disrupt things like hygiene, interpersonal relationships. And when we drill down a little bit more in terms of the emotional well-being for our patients, or at least the impact on emotional well-being, some of our patients will actually tell us that they have self-image challenges with their spasticity because of the way they walk is altered. Also, some of our patients will tell us, geez, I think my MS is progressing because of increasing levels of spasticity, which I encourage people to really listen to your patients, do a proper exam, a detailed exam to tease some of those things out. And when we think about treating people with MS who have spasticity, it really is a team effort. It's not just about treating with medications. There are non-pharmacological interventions that are really helpful and successful. And it's really great to partner up with physical therapists, occupational therapists. With that being said, though, in surveys that are out there, less than 50% of people are satisfied actually with their spasticity treatment. And so we have a lot of work to do to develop different ways to treat spasticity in people with MS.
Well, thank you very much. Those are some very helpful insights. And thank you for taking the time to join us today.
Thank you.